Test, test, test. Check, check. Check, check. 1, 2, 3. Check. Check. Check.
and damn no. tired of it? Yeah, well, who is it? Bob Wexler from Florida. Tired of Congress. You're tired too, aren't you?
I'm just not going to come back.
The Subcommittee on Health will come to order. Today, the Subcommittee will consider H.R. 3792, the Ryan White HIV/AIDS Treatment Extension Act of 2009, sponsored by myself, Ranking Member Deal, Chairman Waxman, and Ranking Member Barton. Let me start with an opening statement for myself, and then we'll recognize other members for an opening statement. In early September, this subcommittee met to review a discussion draft of the bill that was released by Chairman Waxman and myself. And during that hearing, we pledged to work with our Republican colleagues as we move forward. And I'm pleased to say that we have before us today a bipartisan, bicameral piece of legislation. The Ryan White program was scheduled to sunset on September 30th of this year. Unfortunately, we were able to include an extension of the program in the continuing resolution that was passed just a few weeks ago, so all the individuals who rely on this important program can continue to have access to the critical medical services they depend on every day. Meanwhile, we were working hard to reach consensus, and the result of that work is before us today. First, this bill eliminates the sunset provision so that we'll never again face the drop-dead deadline. Though it's important to revisit programs to ensure that they're all still achieving their established goals, these types of sunset provisions can put patient care at risk. All the Ryan White programs have been in desperate need of increased funding for the past 3 years. Modern medical advancements have made it possible for more individuals to live full lives despite an HIV/AIDS diagnosis, which means that there are more individuals living with the disease and in need of services. At the same time, we're experiencing a steady increase in the cost of providing that medical care. So in order to respond to this growing level of need, H.R. 3792 provides a 5% authorization increase for all parts of the Ryan White program. This includes Part D, which has been flat funded for the past 3 years, and Part F, which encompasses minority AIDS initiatives, HIV/AIDS communities, and schools and centers. We've also extended the exemption for those states who are still reporting code-based data directly to HRSA. When we reauthorized the Ryan White program in 2006, we included a provision that would require all states to report their HIV cases to the CDC through a name-based system. This system is more accurate in capturing true cases of HIV/AIDS and decreases the chance of duplication or double counting. Though all states have made progress towards this goal, there are still 8 states whose data is not yet considered mature according to the CDC. To give them time to get their systems fully operational, we extend the exemption that allows them to report code-based data while keeping in place the penalties that were established in 2006. And this includes a 5% decrease in counts to count for potential duplication and a 5% cap on the possible increase in HIV numbers. Now, along those lines, we also established a margin of error for the eligible metropolitan areas. Transitional grant areas, or TGAs, that receive an award in fiscal year 08 will continue to be considered TGAs if they have at least 1,400 living AIDS cases in the most recent calendar year and have obligated at least 95% of their total award. For those TGAs who do not meet these conditions, we have created a new transfer of funds process that will provide a soft landing for the former TGA and ensure that the patients who rely on the services once provided by that TGA will continue to receive those services. The bill repeats the hold harmless pattern that was established in the last reauthorization. This was done to ensure that no area experiences too drastic a cut in funding from one year to the next, thereby destabilizing the provision of care to patients in that area. And this will guarantee that the provision of care is not disrupted, while at the same time shifting funds away from areas that do not have the same number of patients that they once had. And finally, we included a few very technical changes to the current Ryan White program. The small changes we made ensure that patients continue to be able to access these life-saving and life-sustaining treatments and services. I'd point out that despite huge advancements in prevention, detection, and early treatment of HIV/AIDS, there are still nearly 40,000 new HIV/AIDS infections reported each year. And according to the CDC, Approximately 1.1 million Americans are currently living with the disease. Given these high numbers, it's all the more important that we continue the Ryan White program to ensure that these patients receive the treatment that they need and deserve, and I believe that the bill before us today does just that. I want to thank our chairman, Mr. Waxman, Ranking Member Barton, Ranking Member Deal, and my colleagues in the Senate for their work on this bill. I also want to thank the numerous community groups and stakeholders for the effort they made up front in putting together the consensus document. I think the bill before us today is an important step forward in making sure this critical program remains in place and people with HIV and AIDS can continue to access the services and treatments that they need. Let me say, I mean, obviously we still have want to expedite because we face a October 30th deadline once again, even with the CR. I think there's a good chance we could also have this in full committee tomorrow if it's reported out today. And as I said, the Senate is moving as well, so we could. It is important to move quickly, and I appreciate the fact that everyone has been so helpful in achieving that. And with that, I'll recognize Mr. Deal.
Thank you, Mr. Chairman. I want to express my appreciation to you and to Chairman Waxman and to the members of this committee, as well as our mutual staffs for working cooperatively on this undertaking. Also want to thank the advocacy community for their efforts and working with us as well. I will submit my complete statement for the record, but just to simply say that I was one of those who had hoped that we could move to a name-based reporting system. Unfortunately, the 8 states have not been able to get their records in that order yet. The 3 years that we allow them to do that hopefully will be more than enough time, and at the 4th year the name-based reporting will take place under this legislation. I think it results in a more equitable distribution of the resources that are available for dealing with HIV/AIDS. With that, I will submit my statement for the record, and I will yield back.
Thank you, Mr. Deal. Let me mention that if other members of this committee would still like to co-sponsor this, that's, you can do that, and you should just indicate that, either today when you're speaking or just to us staff, and we'll put you down as original co-sponsors on the subcommittee draft. And with that, I'll yield to the chairman, Mr. Waxman.
Thank you very much, Chairman Pallone. I want to thank you and Mr. Deal and Ranking Member Barton and everybody who has been involved in working on a bipartisan, bicameral fashion to present the bill to us today, and we hope to enact it into law very soon. The Ryan White program has been serving people living with HIV and AIDS for nearly 2 decades. It provides care, treatment, and support services to nearly 500,000 people, most of whom are low income. Without this critical safety net, some of our nation's most vulnerable populations would not receive the care and treatment they need and rightfully deserve. Different concerns have been raised about the reauthorization, but one unifying commitment was there from the start. The Ryan White program must not end. We all agree that the HIV/AIDS epidemic is not a partisan issue. It is a human issue. To reach consensus, we all had to compromise. We received recommendations from the Congressional Black, Hispanic, and Asian Pacific American caucuses. The HIV/AIDS epidemic continues to have a hugely disproportionate impact on racial and ethnic minority populations. Input from the Tri-Caucus was not only important, it was vital. And I want to thank you again, Mr. Chairman. I strongly urge an aye vote for this bill. I have a longer statement I'd like to put into the record.
So ordered. We'll put the statement in the record. And, Mr. Shimkus, recognized for an opening statement.
Thank you, Mr. Chairman. As you know, competing markups, and I don't know where everybody else is, but I'm happy to be here. I'm glad we're moving expeditiously to get this reauthorized, and I yield back.
Thank you. Gentlewoman from California, Ms. Eshu.
Thank you for holding this markup. It's an important one. I'll put my full statement in the record. But suffice it to say that this legislation has earned a very fine reputation with people across the country. And so what we're doing is so important in the lives of those that live with HIV and AIDS and the services that are provided. And I think that we've worked out a very good bill, and I look forward to it becoming law so that people will be continue to be served well into the future, and God willing, we'll win the battle, and we won't have to do this legislation anymore because there will be a cure. Thank you.
Thank you. Recognize the gentleman from New York, and let me mention that both Mr. Engel and Mr. Waxman, of course, have both been instrumental in putting this bill together and also in working on the Ryan White Act for many years. Mr. Engel?
Well, thank you, Mr. Chairman, and certainly you have been the most instrumental under your leadership, and we all appreciate the cooperation and the collegiality and the important work you've done on this bill. The Ryan White Care Act holds a very special significance to New York. Unfortunately, we are home to 16% of the nation's AIDS population, and New York remains the epicenter of the HIV/AIDS crisis. New York has nearly 120,000 residents living with HIV/AIDS, and our state and cities have been proud to partner with the federal government in providing care for many of these individuals. New York State receives more than $300 million in Ryan White funds under all parts of the Act to provide a range of health care and support services. Through Ryan White programs, 22,000 uninsured New Yorkers receive medications and ambulatory care services, and thousands more receive other essential services such as mental health, case management, nutrition, and treatment adherence support services. It's critical that Congress acts swiftly on the reauthorization of the Ryan White program, which nationwide provides life-saving medications, health care, and support services to over 500,000 people. As you know, unlike most reauthorizations, Congress inserted a sunset provision into the Act in 2006, requiring congressional action by September 30th, 2009. While we extended temporary funding for the program in the recent CR, as you pointed out, it is important that we do not delay enactment of a full reauthorization so that our states, cities, and localities can be assured of a stable source of needed funding. While 3 years ago, and I remember this well, this reauthorization was the subject of much disagreement and dissent. We're in a different place today. Fortunately, members on both sides of the aisle and more than 250 organizations in the United States have worked hard over the past year to develop legislative principles where there's much agreement. For the most part, we have a bipartisan, bicameral agreement. I applaud the work of the chairman in facilitating the underlying draft we have before us. This will provide immeasurable assistance to the more than 500,000 low-income people served by the Ryan White Care Act programs. And again, Mr. Pallone, I thank you, and I thank our chairman of the full committee, Henry Waxman, who has championed this for years and years and years and years. And it's nice that a lot of this is coming to fruition. And as Ms. Eshu said, hopefully one day we'll have a cure for AIDS, and we won't have to keep doing this. Thank you. I yield back.
Thank you. Recognize the gentlewoman from Colorado, Ms. DeGette. Next is the gentlewoman from Wisconsin, Ms. Baldwin.
Thank you, Mr. Chairman, for calling this markup. It's a real honor to be on the authorizing committee for this life-saving legislation. You know, as Chairman Waxman and Senator Kennedy were writing this legislation almost 20 years ago, I was serving in local government on the Dane County Board of Supervisors, and I was chairing the Dane County Human Services Board and chairing also the Dane County Task Force on AIDS and HIV, just as the first individuals with HIV and AIDS were arriving in our community and seeking health care and other support services. I know many of my colleagues recall those early years of the AIDS epidemic and its devastating impact on the gay community. That devastating impact, health impact, was compounded by misunderstanding about the disease and stigmatization of its sufferers. And in the early years, our policies and our healthcare system really utterly failed to rise to the challenge of HIV/AIDS. Much has changed since the early 1980s. We've had significant medical advances and significant policy advances, and the passage of the Ryan White Care Act in 1990 represented a tremendously important breakthrough. While we have come so far in treating the disease and caring for those who are infected, the crisis is far from over. As the lifespans of people with HIV continue to increase, so does their need to for access to continuous quality medical care and vital support services. The Ryan White program has grown and adapted to provide this vital safety net. In my district, this care is provided by a clinic at the University of Wisconsin, which receives a Ryan White Part C grant. Staffed by very dedicated health professionals, this clinic provides a broad range of services to HIV-positive individuals that don't have health insurance. Many clients travel from all parts of our state to access the state-of-the-art care, and the program provides medical care, social work, case management, and mental health and substance abuse services. But most importantly, they provide a portal to the healthcare system that is safe, confidential, and supportive. I worked with two of my friends and colleagues on this committee to introduce legislation called the Ryan White Grantee Equity Act that would increase Medicaid reimbursement for Part C clinics like the one in my district. Congresswoman Capps and Congresswoman Matsui and I share the concern that these clinics are struggling under the weight of this public health crisis. And many organizations receiving grants through Part C Ryan White Care Act serve a large number of Medicaid patients, as well as indigent patients who have no health care coverage. Unfortunately, these organizations often struggle with insufficient funding through Medicaid. Our legislation is meant to work with states to create equitable funding streams to stabilize operating budgets and improve capacity for care. Mr. Chairman, I greatly respect the work that you have done to negotiate a bipartisan and bicameral Ryan White reauthorization. So I will defer to you and continue to work on this idea in a parallel fashion moving forward. And I look forward to that work with you and my colleagues on the committee to strengthen our nation's response to HIV/AIDS. Thank you, Mr. Chairman. I yield back.
Thank you. Recognize the gentleman from Texas, Mr. Burgess.
Thank you, Mr. Chairman. I'll keep my remarks short. This reauthorization makes several improvements to the Ryan White Care Act, but it does face the uncomfortable fact that we don't have as much money as we would like. It's a hard balance to maintain, but I believe several of the provisions of this bill will be helpful for the population that this program serves. I admit I wish we had the opportunity for a more vigorous debate surrounding the reauthorization. I understand that we were under a tight time frame, but it is my hope that we will not wait until the final hour next time around. As I've mentioned before, the face of this disease has changed and will continue to change, and we have the responsibility to update and evaluate this program to meet those new challenges as they evolve. As far as we have come in the past few years, I remain of the belief that our approach to this program also needs to continue to evolve. I do thank you for bringing a bipartisan bill that addressed some of the concerns expressed by the minority at our hearing on this issue. I do hope the committee will be provided data runs from HRSA, but actually that will not be possible because of the tight time frame. I had hoped we would have mature data from HRSA before we began the markup of this legislation, and it is important to do that so we have a full picture of what these funding adjustments and policy changes, the true effect that they will have in our districts. But, Mr. Chairman, I thank you for the consideration. I'll yield back the balance of my time.
Thank you. The gentlewoman from California, Ms. Harmon.
Thank you, Mr. Chairman. It's a pleasure to sit here and contemplate the fact that we're about to pass very good legislation on a bipartisan basis in this committee. Sometimes it's easy to forget that that's why we all came to Congress. The face of AIDS is any face. In Los Angeles, one of those faces who was a good friend of mine was Elizabeth Glazer, who contracted HIV in a blood transfusion while giving birth and unknowingly transmitted the virus to her child and to a subsequent child. That's a tragedy, and Ryan White deals with tragedies like that and is truly a safety net. Ryan White, as we know, is a payer of last resort, so the program only picks up the costs after other sources of funding are exhausted, and it helps the neediest patients. We heard from Mr. Engel that New York is a huge source of HIV/AIDS patients. So is California. The need is acute in Northern California, but it is also very substantial in Los Angeles County, where Ryan White is absolutely essential. So I salute you and all the members of this committee for being serious about this and for probably offering public policy that will make a real difference in the lives of thousands and thousands of people. I yield back.
Thank you. Gentlewoman from the Virgin Islands, Ms. Christensen.
Thank you, Chairman Pallone, and thank you, Ranking Member Deal. There was a time when I doubted that we would be able to reauthorize Ryan White this year, but you've made sure we could do it on a bipartisan and bicameral basis. And as a delegate from the region with the second highest AIDS case rate in the country, I thank you for your leadership, and I thank the Chairman and the Ranking Member of the full committee as well. It's important also to thank the staff, especially Naomi Seiler, who worked closely with my staff and others to ensure that the Congressional Tri-Caucus concerns and priorities were addressed, and also to thank the consensus, the group that put together the consensus document that guided us through this process. I'm pleased that with this extension, we're keeping those aspects of the Ryan White program that work well, including assistance to large and mid-sized cities with high HIV/AIDS incidence or prevalence, supporting states and territories with their HIV/AIDS-related programs, expanding access to early interventions, family-centered care and support services to women, infants, and children and youth with HIV and AIDS by retaining the grant programs to the community clinics and other nonprofit entities that provide those services. At the same time, this extension strengthens funding levels with the 5% increase, although it should be more, improves the use of ADAP rebate funds to not only benefit the program but also the states, and reverts the Minority AIDS Initiative back to formula funding and its focus finally back to improved capacity building. I had some original concerns about the hold harmless clause, that it might not have provided adequate funding to states which have a growing epidemic, but I think we've adequately addressed that for the time being, and after we want to ensure that after the third year that funding does begin to finally follow the epidemic. I remain concerned that the ADAP is severely underfunded, and although some of the provisions make the program more efficient, it really doesn't end the waiting list and cuts the services that some states have had to employ. I'm also still concerned about the level of funding and commitment to the National Minority AIDS Education and Training.
Donna, can I just ask you to yield? There is a vote in the Energy Subcommittee. I'm going to stay, but if there are members that would like to go down there and vote, you probably can get down there quickly. So I just wanted everyone to know. I'm sorry to interrupt you.
That's okay. Yeah, I'm concerned about the commitment to the National Minority AIDS Education and Training Center. It's a good center. It does outstanding work. And with African Americans, Hispanics, and other people of color accounting for 65% of new HIV infections, more than 70% of new AIDS cases, and 67% of people currently living with AIDS, it needs more support. But overall, I'm pleased that this 4-year extension is a sound, thoughtful, and well-supported effort to keep in place and even strengthen a program that is literally a lifeline to more than 500,000 Americans with HIV and AIDS and their families. And I would like to be an original co-sponsor of the bill. Thank you.
Thank you. We'll add you and anyone else who wants to be an original co-sponsor. Ms. DeGette. The gentlewoman from Florida, Ms. Castor, for an opening.
Thank you, Chairman Pallone and Ranking Member Deal, very much for moving expeditiously on the Ryan White HIV/AIDS Treatment Extension Act. I'm very pleased to be, I hope I'm at it. If I'm not a co-sponsor, please add me. And I'm pleased to submit my full statement for the record and yield back.
Thank you. A gentlewoman from Illinois, Ms. Schakowsky.
Thank you, Mr. Chairman. I want to thank you and Mr. Deal and all those who brought this bipartisan bicameral agreement forward with this bill. I wanted to also just acknowledge the advocacy community, which has been doing such a great job, both nationally and locally. In Chicago, the AIDS Foundation of Chicago has been tireless in making sure that my office and so many others are informed about all the details and the discussions and the concerns that are in our local community and beyond. We have come a long way since the start of the HIV/AIDS epidemic. 20 years ago, someone was diagnosed with HIV, and people assumed it was a death sentence. usually was. The public was often misinformed about modes of transmission, and the science behind treatment was far more limited than it is today. However, we have seen decreases in the CARE Act resources needed to assist healthcare providers and service projects and people living with the disease over the last few years. The decreased funding, coupled with recent data indicating the rates of HIV/AIDS in cities like Washington, D.C., which are comparable to that of developing nations, or news from Montana that the number of infection rates in the month of September was higher than the numbers reported in all of last year, it's proof positive that we need to invest more resources toward HIV/AIDS programs. At the Human Rights Campaign dinner, President Obama said, quote, "We are reinvigorating our response to HIV/AIDS here at home," unquote. That message is a call for swift action on the part of this committee and this Congress to pass a strong Ryan White CARE Act reauthorization, and I look forward to voting for this bill. I yield back.
Thank you. Gentlewoman from Ohio, Ms. Sutton.
Thank you, Chairman Pallone, and thank you for bringing this bipartisan legislation to the subcommittee today for a vote. The legislation makes great strides towards improving the capabilities of providers within the Ryan White program. It also improves the lives of individuals who use the program for life-saving care and support. It will strengthen the Minority AIDS Initiative to make sure that funds in that program are going where they're most needed. And the bill will protect funding for transitional regions dealing with fluctuating HIV/AIDS populations. This bill will also give greater flexibility to Ryan White grantees in the way they obligate funds. Currently, grantees face harsh penalties for not accounting for all but 2% of their funds. And this legislation will increase that threshold to 5%, which will be helpful. Grantees must deal with the basic grant management activities, but they also must deal with the state budget factors, such as hiring freezes that make it difficult for grantees to account for funds down to very, very small margins. Due to these rules, between 2008 and 2009, Ohio experienced a loss of over $2.2 million in funds. And in these tough economic times, we have to do all that we can to give Ryan White grantees a chance to succeed while making sure that they are using the funds appropriately. And finally, I want to speak briefly on a subject that's important to the Ohio AIDS community but is not part of this reauthorization. An estimated 100,000 people living with HIV and AIDS rely on Medicare for their services and drugs. HIV/AIDS drugs rarely have generic equivalents and are extremely expensive. And for that reason, Medicare beneficiaries quickly find themselves in the Part D donut hole where they must pay for 100% of their entire drug costs until they hit the other side. These patients often turn to state AIDS drug assistance programs for help purchasing their medications while in the coverage gap. Unfortunately, patient payments under these programs are not included when calculating Medicare out-of-pocket costs. And as a result, patients cannot access their Medicare prescription drug coverage for the remainder of the year, and they have to rely on these state programs to afford their prescriptions. Under America's Affordable Health Choices Act, H.R. 3200, there are provisions that will protect HIV/AIDS Medicare beneficiaries in this situation, and I hope that these provisions will remain in the health care initiative that we will enact this year. And with that said, today I look forward to the passage of the Ryan White reauthorization in the subcommittee, and I yield back my time.
Thank you. I think that completes the opening statements, and unless there's anyone else out there. Okay. Let's move to the bill. The chair now calls up H.R. 3792, the Ryan White HIV/AIDS Treatment Extension Act of 2009, and the clerk will report the title of the bill.
H.R. 3792, to amend Title 26 of the Public Health Service Act to revise and extend the program for providing life-saving care for those...
Without objection, the first reading of the bill will be dispensed with. Without objection, the bill is now open for amendment. Does anyone wish to offer an amendment at this time? Hearing none, we'll move to voting on the bill. I now move that the Subcommittee on Health forward H.R. 3792 to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the bill is favorably forwarded to the full committee. I just would ask unanimous consent that the staff be authorized to make any technical conforming corrections as the bill moves forward. And without objection, that would be ordered. We do intend, it's my understanding, to hear this, to mark this up in full committee tomorrow at 10. So I just want everyone to know that. And unless there is any further, you vote aye. Can we include Mr. Burgess in the aye vote? Anyone else? Well, we didn't have a recorded vote.
Well, why not? Why not come all the way back up?
We didn't have a recorded vote, so there's really no reason to include you. But we will mention that you were here. Mr. Burgess and Mr. Space were here, along with everyone else. Okay. Without objection, the meeting of the subcommittee is adjourned.
I thought you did that on purpose, sent me downstairs so you'd be able to sneak the vote in while... Hey, Mary, just a little test. Let me see what the audio and video quality of this little gizmo is to see if it's suitable for embedding a video in an email message. We'll be sending it on to you here in just a moment. If the picture shakes at all, it means we're working JP too hard. It is east of the bill. See how you like it, let me know.